Dr. Bowman, you've worked quite extensively with children with autism as well as many different mental health conditions. Can you please elucidate, tell us a little bit about your approach and probably what is the better approach for the treatment of autism? First of all, autism is actually treatable. Can you expound upon that, please?
Yes, I can. Kind of a loaded title. Autism is treatable, and as you know, the prevalence of autism is actually rising. We've done a lot of different things to the environment, and there are a lot of environmental cues as well as some genetic predispositions that has led to this particular prevalence. However, as you know, it is a treatable condition. There are many different ways to look at autism. Treatment is not one single entity that is used. It's very plethoric. Gut, the brain, the diet, nutraceuticals, if you would allow that term. If you give your body the building blocks that it needs to do what it needs to do, it will do it, but they must be there in the right proportions and in the right amounts. And it will tend to do those things. What a lot of children with autism do not have the capacity to metabolize as they really need to. And so there is some deficit, a large deficit, that is noted when the brain chemistry is not in balance. And that is part of the problem. Of course, the gut also has a lot to do with that as well. The things that we take in are supposed to deliver to our entire system, systemically, everything that we need to physically function well as mentally function well.
What kind of imbalances are you seeing in patients who treat children who are autistic and so forth?
One of the
Chemically.
common things that you see in autism is a lack of zinc. Usually there's a large zinc deficiency. Very often there is copper toxicity or just toxicity, period, in terms of minerals and metals. There's also a tendency for there to be what they call histodelia, which is high histamine, which can also have an effect on mood and disposition and demeanor as well. The gut, of course, is another issue, and you need to treat that as well. They have what you call, and many people have heard this term, leaky gut, so to speak, to the extent that many of the minerals and vitamins that you take in simply leak out and are not able to be utilized because they're simply not there. They go in and they come out.
Dr. Bowman, you have a very famous analogy. Would you please tell us a little bit about your battery analogy, the copper tone battery versus the cell that's in the human brain?
Well, basically,
tell us a little bit about that.
Basically,
please.
if you think about what's in a battery, why does it work? I usually use the little analogy of, here's a toy, and I'd like to have this battery and put it in this toy to make the thing work. Well, what exactly is in that battery? What kind of chemicals, minerals are there such that they group together and produce this energy, or at least this functionality? Very often in a battery, you will note the copper top battery, the lithium battery. In those batteries, you find things like copper, zinc, magnesium, perhaps some calcium, certainly other minerals that are there. It just so happens to be that many of those things are the very same things that allow our brains to function the way that it really should.
On a cellular level.
Absolutely, on a cellular level. And when they are in balance, everything works just fine. However, what happens when that battery is out of balance, when it is literally used up, or the minerals, vitamins, electrolytes are out of proportion? The little toy doesn't work so well anymore. Now, ordinarily, we're supposed to regain our strength, regain our ability to, regain our charge by eating, by intaking things which are nutrients, things that, give our body its nutrient basis such that we can make the chemicals that we need to make in order to function physically as well as mentally, and they're really both related. However, in the case of autism, if you have a quote-unquote leaky gut, you might not be able to do those things as well.
So part of the foundational crux of what you do is that you test for these imbalances.
Yes, we do.
And then you use appropriate levels of nutrient concentrations, nutrients, to actually help fix the problem that was in part present because of a lack of those nutrients.
Or you could call it restoring the balance.
Restoring the balance.
And that's really just part of the explanation of what's happening there. If you look back early on in development, the brain actually is very plastic. At least that's a term that's being used or thrown around these days. early intervention seems to be key here. There's something happens with the development of the brain that is missing in children with autism. There's a certain pruning or a certain formulating of the brain that does not take place in the manner that it should. However, if you get a child and it's an early intervention scenario, you can actually help the brain to develop in a manner that is more appropriate.
So early intervention is really key here.
I would tend to think so, absolutely. There's no magic cutoff age, but somewhere between the ages of about up to maybe 9 or 10 years old would be more or less a cutoff in terms of how well that child is able to repair their function.
But you do more than just biochemical imbalancing. You also look at the more holistic approach in terms of the treatment of autism. In other words, other therapies in addition to biochemical balancing, such as speech therapy and occupational therapy and allergic testing and so forth. All these seem to be elements of part of what it is that you advocate in the treatment of autistic children. Is that a fair assumption, Dr. Bowman?
That's a fair assumption. I'd like to touch just a little bit, though, on the other modalities. In other words, let's say that you manage to chemically balance, or at least biochemically balance the individual that you're working with. Okay, so you've done that. Now there's also some training that needs to take place in order for that person to use their balanced state to progress forward, to learn that there are things like RBI, I believe it is, and ABA. Those are just acronyms for some organizations that do exist that help you to actually train, motivate, and
like speech and occupational therapy.
Exactly, which is another modality as well, because there can be these other problems that coexist along with your basic autism diagnosis. And so once you start to put those modalities in place in terms of the therapies that come behind it, what you have is a more complete treatment plan. And there is a team approach to all of this, because this involves a lot of individuals and a lot of therapists, such that all the therapists combined, all the therapies combined actually will benefit the child more so than any one person or any one modality could do.
So there really is no one magic bullet.
There's no one magic
many
bullet.
in the profession are really sort of looking for. It's really a combined approach of both testing, chemical imbalances, therapies, and a great deal of parental effort, plus the parents that are out there working so hard to help their children.
Absolutely.
Dr. Bowman, we want to thank you very much for your commentary and your expertise on this matter.